All right, everyone. It's great to see you all here today. So basically what we're going to do is we're going to talk about ransomware today, specifically ransomware in the healthcare space and steps that you can take to protect yourself from it. So today, one of the biggest questions we have is what is ransomware? How does it affect you? How is it delivered? What does it look like? Right? So we're going to cover that today and explain it in a little bit more detail for you. And then we're also going to jump right into steps that you can take right now to protect your practice from a ransomware attack. And of course, the ultimate goal is how to avoid being a target for cyber criminals. So who am I? Who is Natan? Well, I am a veteran cybersecurity professional. I've been in the field for about 20 years now. Done a lot of work in the government space for Lockheed Martin, Bell Helicopter, Hewlett-Packard, as well as the U.S. Army. I hold several certifications, including a CISSP, CEH, and an MCSE. That is a Certified Information Security Systems Professional, Certified Ethical Hacker, and a Microsoft Certified Systems Engineer. All right, let's get to the meat. So, what exactly is ransomware, and how does it affect you? In times past, cybercrime was much more limited. We had, I'd say, as recently as 5 years ago, occasions where you'd have your individual hacker probably sitting in a dark room somewhere, creating trouble, hacking into systems just to see if they could. Today, it has evolved into a multi-billion-dollar business. Organized crime, typically from Eastern Europe and Russia, even today it's spread to India, has become very well organized. Professional developers have been hired. Professional hackers have been hired. Last statistic I'd seen, salaries are going at about $150,000 a year for hackers and developers to develop new methods of attack. It's become much more organized and much more efficient, and thus a bigger threat. What exactly is ransomware? Let's delve into the meat a little bit. First of all, it's typically delivered through email. It's going to look absolutely legitimate. It's going to look like it's come from your CEO, the IRS, PayPal, that's been another one, even Facebook. That's been another vector as well. What they're going to do is they're going to ask you to click on a link. It's going to look, again, it's going to look legitimate, to either verify your credentials or to verify your login information. Once you click on that link, you're going to find yourself in trouble. The payload is then it's downloaded to your system, automatically runs. You're not prompted to run anything. And once it runs, it looks for all the files located on your computer, your server, any attached media, any network drives, and then it's going to encrypt them with, we call it very strong encryption. It's basically 2048-bit encryption. As of yet, it's uncrackable unless you have the key to decrypt it. Again, like I said, these guys know what they're doing. And then, once everything's been encrypted, you have a couple of options. You can either pay the ransom and hope the hacker on the other end is going to decrypt your files, or you can opt not to pay the ransom and pray to God you have good backups in place so that you can recover all of your files. Healthcare is the #1 vector of attack for ransomware. Just to give you an idea of the stats, the Ponemon Institute did a recent survey just as of a couple months ago, and they found that 88% of all attacks are in healthcare. The next industry to be impacted by ransomware is education, and they're at 6%. So that really gives you an idea of the disparity when it comes to ransomware attacks. So now you may ask, why? Why is healthcare the number one venue of attack? Well, it's for a couple of reasons, but typically the hospitals that are attacked, the practices that are attacked, they don't have adequate security in place to protect against it. That's one. Two, they have as of February this year, they have a reputation for paying the ransom and paying it quickly. And they are, I almost hate to use the word gullible, but that's really what the hackers are relying on. They're relying on the fact that people are vulnerable and you're going to click on the link. And unfortunately, due to the nature of healthcare and the people that work in the industry, they're generally well-intentioned, well-meaning people, and if they see something that looks legitimate, they're going to do it. As of April of this year, more than half of all hospitals across the U.S. have been victims of ransomware attacks. So this is a very prevalent problem within healthcare. Unfortunately, most organizations feel that they have adequate security in place to protect against an attack and an infection. The reality is, unless you have multiple security layers in place to protect against having your files encrypted, you're going to be vulnerable, and you're going to end up paying the ransom. That's just the reality of the industry. Ransomware has become such a prevalent issue within healthcare that HHS, which is the Department of Health and Human Services, has recently put out guidance on how to respond to a ransomware attack. As of the latest publication, they are now requiring all business associates, all covered entities, to report a ransomware infection as a data breach. So whereas before, ransomware wasn't necessarily treated as a data breach and it wasn't treated as reportable, now anytime that you're hit with ransomware, it doesn't matter how many machines are infected, how many patients are affected, it has to be reported to HHS as a data breach. And if you fail to do so, it will result in fines from OCR. That's just the reality. Today, I would say this tool was put out probably just a couple weeks ago. It's very, very new. This is an excellent tool that you can use in your organization to see how vulnerable you are to a ransomware attack. What I'm going to do right now is I'm going to run you through a quick demo just so you can see how it works in real time. I'm going to go ahead and turn off my antivirus as well. This software is through one of our partners. They're called KnowBe4. They are an excellent organization when it comes to training staff and employees. I've already run this once, so I'm just going to rerun it again. Okay, so let's run this and let's see exactly how vulnerable I am. Now, just as a caveat, I've taken myself off of the firewall, so I'm no longer behind the firewall, and I have turned off my antivirus.
So, Natan, as we're running this test, a couple quick questions that came uh, through the webinars. You mentioned healthcare as being a big target. Why is healthcare such a big target for cyber criminals today? Is there any benefit to them getting maybe a patient's personal health information?
Oh, absolutely. Uh, the and on the dark web, the average cost a credit card record is between $8 to $9 a record. Very, very low end. By contrast, a healthcare record is worth $60 per record.
Wow, that's a
So
big jump.
that's a big, you're right, that's a significant differential. So if you can imagine, say for example, so we'll say $60 a record, right? We'll run a quick calculation here. $60 a record. The average breach, there's about 10,000 records compromised, so it's worth $600,000.
Wow. And has there been any fines levied by the HHS or the OCR as a result of medical clinics not taking the necessary precautions to protect themselves from ransomware?
Oh, absolutely. Um, they're huge. Uh, Depending on how negligent OCR feels that an organization has been. In other words, if they haven't done a risk analysis or they failed to encrypt a laptop or a mobile phone, um, the fines typically that we're seeing today have been in the neighborhood of between $3 to $4 million. But that's not the least of their concern. The other part of the coin is the lawsuits that come in the wake of that. There was a large oncology facility that suffered a breach earlier this year. Um, Something in the neighborhood of millions of patient files were lost and compromised. The class action lawsuit that followed that was $50 million.
Wow, that's a big fine to pay or settlement to have to come to terms with.
Exactly,
Now,
exactly.
are these what size healthcare organizations are these that are getting these type of class action lawsuits? Do they range from the big hospitals, or are we really talking about like even just a small medical clinic?
The large lawsuits we've seen with typically the larger organizations. For example, the oncology center, they have facilities all over the country, so they're a little bit on the larger side. For the smaller clinics, we've seen fines varying anywhere between 600,000 to about 2 million, and that's on the side of compliance and OCR.
So basically, the threats do exist to all sizes of medical facilities and clinics and
Right.
organizations, and but also there are and I I heard as well that the governing bodies are stepping up their enforcement at all, especially this year across any size of a medical organization, large or small. So
Yes.
I guess the warning that you're telling people here is to, if you're a two-man doctor office or a 2,000 employee hospital, the threats are real, no matter regardless of what size you are.
Yep, that's exactly correct.
It looks like your scan has been. I don't know if this is completed or you have one more thing to check now.
Yep, I'm gonna run one more.
This one seems to be going a little faster.
But you're touching back on enforcement. Yes, OCR specifically has been given guidance down from HHS this year to really take a harder look at business associates and covered entities across the board to really push harder for stronger security practices and cracking down on non-compliance. So that's why we're seeing harsher fines. We're seeing, whereas previously the maximum fine was $1.5 million. That number has gone out the window this year. The highest fine we've seen to date, I think, was $5 million.
Wow.
So yeah, it's no longer is OCR really taking a laissez-faire approach to non-compliance. They're really cracking down hard on organizations across the country.
Great. So explain what we have on the screen here, so everybody understands.
Sure. So it looks like, despite my best efforts to foil myself, I have a lot of different layers of security in place to protect against an attack. What we have here, let me see if I can enlarge this at all. So what we have here is the results of the scan. What it does is it ran, first thing it did was run a replacer. Just simply replacing the content of the original files. That one failed, so it came back as now vulnerable. The strong encryptor, which encrypts, again, this is a simulated attack, it's not an actual attack, which encrypts files using strong encryption and deletes the originals. And that one failed. This strong encryptor fast, it's basically the same thing, it just works quicker. Strong encryptor net, what that does is, in addition to trying to encrypt and delete the original files, it also simulates sending the key to a remote server. Again, that one failed. And the weak encryptor, which is I guess you could call it a more watered down version of encryption, that works much the same way. So again, despite my best efforts to make my system vulnerable, I just have too many layers of security in place to do that. But this will give you a good idea of how it works, what you can do, and I'm going to enlarge this again. If you'd like to try this, you can go to this link right here in the slide, and the slides will be provided after the webinar. Download it, run it, and see how it turns out. Now, I know I've talked to several other peers in the business. They've run the same tool, and they've come up with 5 out of 5 vulnerabilities. So it really depends on the security tools and processes you have in place to protect against this type of attack, whether or not you're going to come back as showing vulnerable or not. So the big question, how do you protect yourself? What do you do to protect against a ransomware attack? So I'm going to go into 8 different steps, things you can do right now to protect your practice and your organization. The way we look at security, I think the onion analogy is really appropriate. Basically, to get down to the core of it, you have to go through multiple layers to get that inner part. And that's really how you should look at security. Instead of looking at it from the perspective of, okay, well, hey, I have a firewall, I've got antivirus, I'm good. Not quite. There's a bit more to it than that, and I'm going to delve into that. So the first thing right off the bat, and I mentioned this earlier, is education. Education and awareness of cyber threats are going to be your #1 preventer. The human element is considered to be the weakest element in security. People are vulnerable. People are gullible. Um, if you get an email that looks legitimate, it's from your boss or it's from the IRS, they're trying to use scare tactics to get you to click on a link, or your boss says he needs you to approve, let's say, a wire transfer, for example. You're gonna, 9 times out of 10, you're gonna click that link. So the first thing right off the bat that we recommend is implementing an employee training plan. We have at VITECH, we have weekly cybersecurity tips. You can find us on Facebook, or Twitter, or LinkedIn. Just different tips and tricks that you can leverage in your practice to really generate awareness for your staff and for yourself. The last thing you want to do is be vulnerable to an attack. Second layer is requiring strong passcodes. We're touching on mobile devices here, but I'm going to expand that a little bit and say not just for your mobile devices, but for everything that you touch. Require strong passwords for your computers, for your EHR systems, for social media, and for your mobile devices as well. You really need to take a paranoid approach when it comes to security. That's really the only way that you're going to stay one step ahead of the game. And the other thing I want to touch on before I move on here is don't make each password the same. Okay, we've seen that a few times. I know it's the easy thing to do, to make every single password the same thing, because you don't want to have to remember multiple passwords. But if you do that and a cyber criminal gets a hold of just one of those passwords, now they have access to everything. That's you don't want to help them any way you can. We touched on this just a minute ago. Again, strong passwords, strong passwords, strong passwords. Don't use any dictionary names. Please do not make your password the word password. It's common. Like I said, I've been in the industry 20 years. I've seen it many, many times. Please, for your sake, don't do it. Encryption. Encryption, not just for your mobile devices, but for your computer systems, for your servers, your files. It's really the way to go if you want to stay ahead of the cyber criminals. And when it comes to compliance, it's almost a get out of jail free card. The recent guidance from HHS states that if your system's encrypted, even if you have a breach, even if you have a ransomware attack, you do not need to report it because no unauthorized personnel have access to that data. It's encrypted, it's safe, you're good to go. Here's another big one. Keep your devices patched and keep your patches current. One of the other main exploits or vectors of attack are unpatched systems. Very, very easy to exploit a device or a system that hasn't been patched. It's easy enough to implement a patch management policy. Please make sure you update your third-party software, the most vulnerable ones like Java, Adobe, and Flash. Keep those up to date because those are the most vulnerable to attack. Backups. It's not enough to just have a backup and say, oh, okay, yeah, we've got backups in place. Well, that's great. Number one, when was your last backup? Number two, does it work? I can't count the number of organizations that we've worked with didn't have good backups when we started working with them. One organization we were talking to a few months ago, their most recent backup was a year ago. So please, if you value your data, if you want to protect yourself against an attack, make sure you back up on a regular basis and run through a monthly test. Just make sure it works and just make sure that you can recover against the data. It's simply a good business practice. Now, I'm going to elaborate on this one a little bit more and say that don't allow employees to access PHI with personal devices. So if you have PHI outside of your EHR, as is often the case, you have names or email addresses on spreadsheets sitting on your computers. Please do not email that back and forth. Do not use your mobile devices to access it without first ensuring that it's a company-approved device, right? Make sure that you can control the device. You can lock it down if you need to. If it's lost, you can wipe it. And if the need arises, you can retain that equipment upon termination. It's just a better way to go. So we talked earlier about the different layers of security. One of those, and this is very important, is a UTM firewall. So what is UTM? UTM is Unified Threat Management. These next generation firewalls are better equipped to handle modern threats. So they have things like built-in virus scanning, intrusion detection and prevention, website filtering, malware filtering, data loss prevention. They're really better equipped to handle modern threats than older model firewalls. So even something from as recent as 2 to 3 years ago, if you haven't replaced it, you probably should. Spam filtering, again, like I said, this is something that's typically built in to a next generation UTM firewall. It'll strip viruses from your emails, block phishing attempts, and prevent malware. And it also increases productivity by cutting down on the number of spam emails that you and your employees have to deal with. This is a big one. Controlling which websites your employees are accessing. So if you have a next generation UTM firewall with web filtering in place, this will block malware sites before somebody even tries to go to it. You can lock it down to blocking things like social media. So you can stop people from getting on Facebook and Twitter and generally wasting time. And by doing so, increasing productivity. Now, if somebody wants to, say they're on their break, they want to get on a Facebook account, they can do so on their own time, and it doesn't have to be on company time. So the bottom line, take it seriously, take cybercrime seriously. It's not, what's the word I'm looking for? It's not a small threat. It's a big threat. Healthcare is the #1 sector for attack, and if you're not prepared for it, you're going to find yourself, one, you're going to end up paying the ransom in the thousands of dollars. You're going to be hit by OCR fines in the millions, and if that weren't bad enough, you'll likely be hit with a class action lawsuit in the millions of dollars. It's really a very, very serious problem and a serious issue, and it should be taken with the utmost seriousness. So here are some things you can do to get started. So #1 is threat assessment. Go through and if you're the practice owner or manager, ask yourself these questions. What's lacking? How are employees using your company-owned devices? What third-party apps are you using? Are your systems really backed up? And where is your biggest area of risk? Where are you most vulnerable? Next thing you do is implement a plan of action. Go through based on what you've discovered and find out what you need to do to ensure your systems, your data, and operations are secure. And put it into place right away. Don't put it off. Don't wait, oh, we could do it a week from now, a month from now. No, because then you're leaving yourself vulnerable. A week from now or a month from now, you could be hit with an attack, and you just lost millions of dollars because you didn't want to take the steps you needed to protect yourself. Ongoing maintenance, that's always going to be an issue. Security and compliance, they're not a set it and forget it. It's an ongoing process. You need to constantly evaluate your systems, your tools, your procedures that you have in place. Training should be done on a constant basis. We recommend employee training at a very minimum on an annual basis, but if you're going to take a more proactive approach, at least on a quarterly basis. All right, well, you can do it yourself. If you're technically savvy and you have a background in security and you know what you're doing, you absolutely can go that route. That's something you can do. Typically, we find that unless you have a lot of experience in the field, if you do it yourself, you're going to miss a lot of things. That's just the nature of it. Or you can outsource it to somebody else who has the experience and knows what they're doing. And we're here to help you. If you have any questions, if you need help with any training, you're concerned about compliance, you're concerned about ransomware, please feel free to shoot us an email or give us a call. We're here to help you. All right. At this time, does anyone have any questions for us?
All right, Natalia. We addressed some of the questions earlier while we were going through the demo, but
Sure.
There's always a few extra questions that come in near the tail end of a webinar. So, you mentioned backup and the way as a way to protect against loss of data. What type of backup do you recommend? Something that's on-site, off-site, or kind of a hybrid of both?
The best approach is to do a hybrid approach. If you have off-site backups, that checks one of the boxes for compliance. So that's definitely something we strongly recommend. And you can do that through an encrypted cloud backup, and that works very, very well. But if you need to recover quickly, if you need to, say for example, a complete image of a server or your computer systems, an on-site backup is the way to go. It's going to get you back up and running within minutes.
Excellent. And when it comes to protecting a network, especially in the healthcare space, you mentioned some UTM firewalls and a few other recommendations. Is there any particular firewall solution that VITECH recommends, one over another? Can they run off to the local, Fry's or Best Buy and just pick one up on the shelf, or do we need to come to a professional like you to get more of a business grade service?
I definitely do not recommend running out to your nearest electronics store and picking one off the shelf. You're asking for trouble if you do that. I highly recommend going to a security professional like myself or another qualified security firm and asking them for a firewall that best fits their environment. So there's a couple particular vendors that I recommend. I recommend My Digital Shield. It's very, very effective firewall, works very well, and Checkpoint. Uh, those are the big two that we recommend.
You mentioned My Digital Shield, and I know we are a partner with them. Explain My Digital Shield. How does that work for for the healthcare practice managers or professionals that are on the call today? How does a solution like My Digital Shield work?
It's it's really it's very, very easy to set up and configure. It's basically a small form factor device it's almost plug and play. You plug it into the network, get it powered up, go through a few simple configuration steps, and it's up and running within minutes.
Great, and that monitors traffic on the network.
Yes. Yep, that'll monitor your network traffic. That will protect against malware infections, ransomware specifically, and as well as including things like spam filtering and malicious website filtering.
Great. So, Natan, any last minute closing comments you'd like to make on the call today?
I think the biggest thing I want to get across is, number one, ransomware and cyber attacks in general are a very real threat. Do not take a laissez-faire approach. Take them seriously and take the steps today to protect yourself against them. Don't put it off. Don't wait a week. Don't wait a month. Do what you need to do right away.
Excellent. Great. So, Natan, thanks very much for the excellent information that you shared with us today. We're looking forward to an encore presentation of this webinar coming up in the next few weeks. We had so many people register for today that we possibly couldn't get everybody on the call. So thanks again for your time, and stay for those people that want to watch a repeat of this, we do have this webinar recorded, and we're also going to do an encore presentation of this presentation in a few weeks' time. So watch your email. Natan, once again, thank you very much for this great information today, and we look forward to learning more from you again in about 2 or 3 weeks' time.
Absolutely. Absolutely. Thank you, Stuart. I appreciate it.
Thanks, everyone.